So I've been thinking, I don't know, the last few days about the people. I feel bad for the young and all that with where our country's going, but I find myself feeling like really bad to where I'm like in tears when I think about it. Is for the people that escaped Marxism, communism from wherever, Yugoslavia, back in the, wherever from around the world to come here. And then they've recognized it for a couple years now, if not longer, where America was headed. And when you see, and I just watched this video of this creator that I follow, and he always puts up good videos. In fact, I'm going to duet it. But it's his neighbor, he says at the end. And the guy's just almost in tears, and he's older. But this is somebody who's an expert. He lived under it. Anybody who's lived under it knows the signs. And yet, what are we told in this country? To trust effing experts at the university. And they can't even recognize it on their effing campuses. So I feel so, my heart like drops for them, because I imagine how terrifying it must be to have escaped that, to have lived through it, to have lived through living under a system like communism, and then getting to America and knowing what America used to be like, and looking around how even Americans don't realize how their country is not what the founding was anymore. And it's because of sick, twisted people. And I keep saying it, that are far too educated. It's almost like maybe, the people shouldn't be running off to college until you like learn some stuff about yourself first, so that you can recognize the world around you. Academia is not the most important thing. It certainly is not. You will only know the world around you, not by the academia and degrees you get, but by knowing yourself. And I don't see any of these higher educated. I haven't seen it in my profession at the top forever. I haven't. I've seen only corruption from the day I got into nursing. I mean, it's because of them, not me. But these were the people I'm always told, and it doesn't matter that they know best, and yet everything I've ever seen them go along with is destructive, or it takes care away, or it takes staff away while they help to create, like the very nursing profession and the unions working with the hospital CEOs to create the situations just so they can enslave people into unions and just bring in, cheap labor so they support open borders. It's like, and these are the people that have 15 letters after their name. Like, this is the stuff that that's why sometimes when I read psychiatric, articles, I'm just like, these people don't have a clue. Like, they don't, because I get, okay, they have all the science and blah, blah, blah. That's not the only part to mental health. Like, that's what's really been lost. It's like, it's not. Care is the first. Care goes a long way. I'm not saying it'll cure anybody, but it certainly wouldn't hurt for sure. There was one paper, because I struggled with this in my first few years of nursing, because I'm like, oh no, this is wrong and that's wrong. But this is all just being a caring person. It's like they want to take care away. And the very people that have the most education don't even, they talk about empathy, they talk about care, but they don't recognize that they don't have it. Because if they did have it, they wouldn't do the stuff they do. They just wouldn't. But I've seen nursing care more about letters after your name than the care you provide. And it's like, so you lose all respect for it. Not other nurses you work with, but you lose all respect for the people deciding everything, because they shouldn't be deciding anything. So I'm a firm believer that the academia, all your degrees are not, I don't care if you're a doctor, I don't care how many degrees you have. If you cannot recognize what's going on around you, then it's because you do not have enough insight. You have not observed yourself and the world around you enough, and you've just been sitting in a classroom too long. So yeah, we need to totally get away from this idea that having all these degrees makes people experts. Most especially, I've seen it for the past 12 years that not be true, but in the past 4 or 5 years, I definitely will say without a doubt it's not true. In my profession, for sure. Again, talking about the associations, the people that dictate care. I had once read a paper, okay, and I'll never forget it because I totally resonated with it. And it was a peer-reviewed article out of Sweden. And I thought they have it down. They get it. These are experts that get it. And you could tell by reading the article it wasn't fake. I tried to give it to, it was called The Case for Caring. Yeah, it was peer-reviewed, all of it. You wouldn't be able to find anything like that here in America because I've looked. Everything is about drugs, everything, and it's like, where is the most important component to what we do in psych? I don't know. Because I think a lot of people think, yeah, I care, but do they? I don't think that a hospital, or you can really say they care when they cut staff. I mean, if they really care about patients, they wouldn't cut nursing staff. Because, especially in psych, because then when you do that, it's less time that we can spend with patients, assessing them and building rapport and all of those things. So it's not caring. It's placing money above everything else, and that's what the hospitals have been doing, at least that I've watched for 4 or 5 years now, especially since COVID. Everything is about money, and so it's really sickening. But this article was basically about that the problem with people in mental health, and that's that there's so many of these barriers. It's like, you just be a caring person. You know, like, I mean, yeah, I'm not going to give a patient my phone number and all that kind of thing, but I'm just saying that the education system has built this barrier around people. Like, I can't explain it. The article was really good, though. And the point of the article was that you will never help somebody, say that somebody is down in a hole and they can't get out. Okay, so depression, whatever it is, they can't get out. They need you standing at the top of the hole, yelling down to them, come on up, come on out. Yeah, just start. They won't do it. You have to be willing to get in the pain with them. It doesn't, and the article said, it doesn't mean you take on their pain. It doesn't mean that, but that you are strong enough to face that with them. Now, many people would argue that, oh, well, that's what a therapist's job is. No, this article was about staff on a unit. That you have, mental health patients, especially, now I'm not talking so much about the psychotic patients maybe, but depression, suicide, they can tell if you're afraid to know their pain. And there's some people that are. But if people, the point of the article was you have to get down in the hole with them and help them up. So yeah, nobody on a psychiatric unit is going to save somebody in one admission. However, it's building a rapport. It's helping somebody just by doing that. Yet much of what we're taught here in the States is everything is, oh no, we can't do this, we can't do that. It's like, yeah, can we just get back to caring? That would heal the world so much. But when you have nothing but Marxists, Leninists, and communists running your government, running your universities, running your healthcare system, well, then nobody's going to care about anybody. And the people that think they care don't realize that they've already been controlled by that system. But the people that recognize it, and they will explain it the best to you, are the people that have lived under communism and escaped it. And it's heartbreaking now.